Information and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us at 954-717-7027. And today we have Dr. Safia Ali, MD.
Hi.
Thank you for coming. And she has a very in-depth bio. We're going to delve into that, but I just want to let you know the SamsaraMedSpa.com is at 331 North University Drive, Suite M2-800. That's in Plantation, Florida, 33324. The phone number there is 954-688-7255, and the email is info@SamsaraMedSpa.com. Thank you so much, Dr. Ali, for joining us again.
Thank you for having me.
We appreciate you coming and taking time out of your busy schedule.
Absolutely, absolutely.
Because I know you're doing your wound care and then now the med spa, so we know that you're quite busy.
Oh gosh, yeah.
So if you can just tell us a little bit about your background and where'd you go to school, what made you want to become a doctor, and then take it from there.
Thank you. Yes, absolutely. My background is that I am born and raised here in South Florida, and I've always had a passion for medicine and wanting to help people. Mm-hmm. And it was at a young age where I saw that the pediatrician that treated me, my mom took me to, was a woman. And I thought, oh wow, it's a lady doctor, you know? Because up until then I'd just seen male doctors. And so that kind of inspired me, and my parents were very supportive. So that became my passion, that I really wanted to be a doctor and help people and heal them.
Sounds like you knew at a young age.
Oh yes, I knew. Sometime around 6th or 7th grade.
That's your passion. That's your purpose.
Oh yeah, definitely. And so I just studied hard. I ended up going into a gifted science program, and I graduated and got a full scholarship, academic scholarship, to the University of Miami for undergrad and med school. And that's been my journey, educational background. I then did my intern year at Mayo Clinic for family medicine. I loved that it was a very comprehensive field. And I finished up with, my transitional year was at Mayo Clinic, and I finished up in family medicine at Advent Health in Orlando.
Oh,
yeah.
Nice.
And so since then, I also further certified in ER medicine. And I love the quick pace of ER medicine and really healing people on the spot.
That's like high adrenaline, right? You just don't know what's going to come in, right? Just be ready.
Be ready, wide variety. And that's how I've always functioned. I like helping people in many different aspects, not just one cookie cutter aspect. And then COVID happened. Yeah. And that was extremely challenging.
Sure.
And after that, during COVID, what I had seen though was a tremendous amount of wounds that were occurring. People were staying home, they were falling, especially in the elderly population.
Right.
And so I decided that became my passion, and I became specialized in wound care and hyperbarics.
Now let's delve into hyperbaric, because I feel like recently, or maybe not recently, but over the years, it's just more and more studies and more, you know, of them realizing how it helps wound care, and it's just how it helps us in so many different ways. So I'm glad to see more doctors are promoting and using the hyperbaric.
Yes, it's gaining traction and popularity.
Gaining traction, that's right.
It's a niche field, and it's been around for a while, actually through the Navy, with the compressed oxygen treatment that they would give to the military men. And then they saw how wonderful it was doing for wound care and war wounds and whatnot. And it became more of a part of traditional medicine.
Nice.
And so I would say in the last 15 years or so, it's become very popular. And I'm proud to say that HCA Hospital has 2 hyperbaric chambers.
Wow.
And we dive our patients very safely with compressed oxygen. And it just makes their wound healing so much faster.
I have a good friend of mine, her son had a very serious brain injury, and he had a series of hyperbaric treatments and tremendous changes.
Oh yes, it also helps with neuro recovery post-trauma incidents. So not just skin, internally and also with the brain it helps.
Wow. Does it help with inflammation or just
That's
everything in general? Inflammation?
Exactly. You hit it on the dot. What it helps with is it creates what's called angiogenesis, where you're growing new arteries and blood flow to an injured, inflamed area. And then while you're on antibiotics, it allows that pressure to make the penetration of the antibiotics so much more deeper into the tissue and into the bone where the infection lies, and causes it to be a chronic non-healing wound. So the science behind it is amazing.
Yes.
And it's cutting edge technology. And I'm just very proud that we're able to offer it at our hospital.
I'm so happy.
Yeah.
So what type of patients, like people with diabetic wounds or wounds where they've fallen as well?
So it's basically your non-healing chronic wounds that have been infected and festering for a while.
Okay.
And that would, yes, include your diabetic wounds, especially foot ulcers, radiation injuries, people who had cancers.
I didn't even consider that.
It's a big component of their healing process because, for example, I've had post-radiation injury breast cancer patients, and you know they're not healing well, and the tissue has been damaged from the radiation. So this helps heal that.
Wow.
You know, also your what we call refractory osteomyelitis, a bone infection that just will not go away. So this helps heal that out too.
That's interesting.
And burns are also qualifying for that, crush injuries, post-surgical flap failures, when a person has a gaping wound and a flap is created to close the wound and that fails. This helps to heal that tissue. So there's a lot of variations of how you use the hyperbarics, and we qualify the patients for that.
I imagine it's so rewarding because each time they come in for a treatment, you're actually visually seeing the improvement each time, right?
Absolutely. It's such a journey with these patients. From day one, you're with them and you're looking at them as a whole person. You're doing their whole case management. It's not just about the wound, it's about what's going on with them socially and mentally and with their specialists and coordinating their care. So we become like a family for them. And so we're with them on this journey to heal that wound where it's this gaping, ulcerating wound, and at the end they're healed and they have baby skin and it looks great.
Nice.
And
amazing.
They cry, we cry, they ring the bell, and we're all clapping.
I love that.
I have such a phenomenal team where I work. I just couldn't be prouder of my environment.
That's so important. So do they accept all kinds of insurance as far as?
Yes.
Okay, and the demographic, is it an older population or do you see all types of ages?
I see, well, that part of my background and training is family medicine, which is traditionally from cradle to grave, the whole age span. I do have a couple of pediatric cases or younger adult cases. Majority of patients with these type of wounds, though, tend to be on the older side, and it's more of a geriatric population, but we see everybody.
Wow, that's amazing. So now let's transition to, because you're so busy and doing this and COVID, and then what sparked the idea for the Samsara Aesthetics and Wellness? How did that come about?
So I like to think of it as the right and left hand. It's skin. I'm seeing skin through a wound lens where it's chronic and non-healing, and then I'm seeing skin through a beautiful lens where it's aesthetic and you heal it and you're trying to make it look its best version. So while I was getting certified in wound care and hyperbarics, at the same time I was also getting certified in Botox and fillers and PRP therapy and any and all modalities we can use to help better the skin. And when you better the skin, people feel better about themselves. It's a mental health therapy, and they just have a layer of confidence inside that they didn't have before.
This is so
So
true.
it's a journey. And so I was doing both at the same time, and I felt so good while I was doing it. I knew it was a feeling inside. I knew that this was my calling. So
I like how you have all aspects of the from the wound care all the way to
yes.
to the aesthetics. Now what I'm noticing is you said Botox fillers, but you also said PRP. Now I know that the platelet-rich plasma is also can you explain? I don't want to botch it up. So can you tell us what
it's
PRP is?
I mean, no problem. In a nutshell, we draw your blood, we spin it down, and that top layer is your plasma. That has all your healing factors in it, all your growth factors in it. It's rich, like you said in the name, platelet-rich plasma. The platelets are in there too. And all these components and factors that are in that liquid gold that we get out of extracting your blood, when we reintroduce it to your trouble spot, whether you're having a psoriasis flare-up or eczema flare-up or acne or any kind of trouble with your skin, melasma where you had a baby and you have all these dark spots.
Right.
And personally that happened to me when I had my babies.
It's hormonal.
It's hormonal.
Yeah.
So this helps restore the balance. And I feel like it's natural and organic because it's your own blood. We're not ordering any other products.
I love that.
And we're reintroducing it to your skin where, circulation maybe wasn't going there initially. So this kind of boosts the healing process in that area, and it evens it out, and it gives you that beautiful glow you're looking for. And it also helps with joint therapy too, which we offer at our med spa.
Oh, so we have somebody in the audience have a couple of questions. Go ahead.
Hello, thank you so much for having me here on the show.
Absolutely.
And it's a pleasure to meet you because
Thank
I'm
you.
a huge fan of what you were doing, that you were utilizing your background with healing with skin.
Yes.
Because I am a licensed esthetician, and I know that wrinkles, Dr. Perricone, he's one of the first doctors that really brought it to my attention that it's really inflammation in the body. And what you said about what the product that you have, and then you're bringing it to the skincare world, aesthetic world. Fantastic. And now, are people educated in this, or how are they learning about this?
Good question.
We're trying to bring more awareness to the plasma-rich platelet therapy. But it's gaining popularity, kind of like the hyperbarics. It's gaining popularity because people are wanting to find a way to naturally heal themselves, naturally look their best. So this kind of falls into that category. It's organic. It's from your own body, and we bring awareness through like platforms like this. We do little sessions on our website. We also do postings on our Instagram. If you want to follow us,
What is
please.
that? Please
Yes.
plug it in. What is the Instagram?
Please follow us at Samsara__aesthetics on Instagram.
Okay.
And if you go there, you'll see posts about all the different healing and modalities we're offering for you looking the best version of yourself. And this is one of them. So we're trying to get the word out as much as possible. In the near future, we'll be dropping some segments on YouTube. We're just getting started, so it's going to take a little time, but yes, we're trying to bring public awareness to all of it.
I'm a big fan of, I've never done Botox, but of like hyaluronic acid on the Marietta. This is Marietta, right? On the Marietta lines and also on the cheeks. I think that's helped me a lot. And it just because, in Brazil, where my family is from, we believe that you have to do it before you really need it.
Oh, preventative.
Like preventative, exactly. So with that said, I love everything that you're talking about. And now back to your culture. You said your family's from India, you said?
So my grandparents are from India and my parents are from Pakistan.
Okay, because I'm asking you that question because the medicine from there, it's so advanced in my eyes.
Yeah.
Ayurvedic medicine.
Ayurvedic medicine, yes. It's more of so here on the western side of the world, that would be more of a functional type of medicine. And that is exactly what we're offering at our med spa, functional medicine. If you want to come and do consults, it's myself, my partner who's also a physician, Dr. Yves Jodesti, and we also have our other partner who is a criminal law specialist. He's a lawyer. His name is Shamir Alam. They were both supposed to come today, but they are actually consulting, so they couldn't make it. So I'm representing our group. But yes, we are offering functional medicine, so you can do a consult with myself or with my partner, Dr. Jodesti, and basically is to go over a plan of care individualized for you, given your labs and hormones, and moving forward with rebalancing hormone therapy, peptide therapy. We also offer IV hydration with different vitamin mixes. So it just depends on what you need, the individual you.
I was going to ask you about that because, you know, as we get older, as women, we go into menopause. And you know, a lot of people that I know, some do hormone treatments, some don't, some want to do it the natural way. I'm very curious about what you have to offer.
So we're first going to launch our program with mesotherapy, okay, and peptide therapy. We're going to get labs from our patients and see where there might be maybe a vitamin deficit going on. If there is a hormonal deficit going on, then we do have specialists on board who we can do consulting with to figure out a hormone plan for patients like that.
So Dr. Ali, we'll be right back. We have a quick commercial break.
Sure.
When we come back, we'll continue the conversation.
Okay, great.
Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in to You and Your Doctor, sponsored by All County Healthcare. Again, we're welcoming back Dr. Safia Ali, who is, her location is Samsara Aesthetics and Wellness, located at 331 North University Drive, Suite M2800, Plantation, Florida, 33324. The phone number is 954-688-7255, and that is samsaramedspa.com. I am just so intrigued, Dr. Ali, by all of the different offerings that you have. You were saying the BHRT. I think you were saying nutritionist. So tell us what else you have to offer. I know you're treating each person individually.
Yes. So we have our aesthetics, but then we also have wellness. So with the wellness aspect, we are launching our physician-led medical grade weight loss program, because weight is such a big component.
Sure.
It affects your hormones, it affects your metabolism. So we are starting that out with the semaglutide, which is similar to Ozempic, okay? But it is more affordable, and it also has equal results. It's FDA approved. So we're gonna be incorporating that into our practice, and along with that, the program, the way it goes is that you are getting on the semaglutide injections. We are monitoring you. We see you weekly. You do a weigh-in with us. We're seeing how your progress is going, whether you're hydrating, you're eating the right amount of protein with that. And then along with that program, we have a nutritionist on staff who can do meal planning with you and figure out what are your needs and what your habits are to help do a lifestyle modification. Because it's not about just dropping 20 pounds, because if you don't make the necessary changes, it's just going to come right back on you. So at Samsara, we're all about mind, body, and spirit, and incorporating everything together moving forward for you, so that it's not just a quick fix or a Band-Aid, it's a long-term journey for yourself.
And that's really where those results stick. Like you said, it's really creating that and integrating that new lifestyle, because those are the habits that create, you know, what we want, the results we want.
It's three components. There's the medical aspect, then there's your nutrition, and then there's your fitness level. I mean, what's so underrated is just going for a walk. Everyone thinks they have to like pump it so fast. I mean, going for a walk, taking baby steps. So we're just, you know, going to work with you with your schedule and what your lifestyle is at that moment, and we can figure it out together so we have realistic goals.
What I also like is you have in the facility specialists who deal with, like, you have the nutrition to deal with that component. You have the professional, you know, aesthetic person. You have the person who's going to do the hormonal labs. So I like that. It's really specialized, and that's really important for people to know. It's not just like you go in and this is what we're doing. You really thought about it thoroughly and have those specialists.
I can really acknowledge what you're saying and support it, because when we were coming up with our mantra for all of this, we wanted to make sure that it made sense and it was right, ethically right, and individually right, and morally right. I love skin. I love seeing people happy and looking their best version of themselves. But what is that best version? Only you're going to know. It's not me telling you, well, you need to do X amount of Botox. I mean, it just depends on what your goals are, what you want to look like, and how you feel about yourself. And that's where I want to touch on our wellness, because we have mental health as part of the practice too.
Wow.
And if there's a need for patients to have counseling or life journey coaching, we're offering that as well.
Wow, you really thought it through very thoroughly. So Dr. Ali, we actually have 2 minutes left. I know this interview has gone by really quickly so already. So in these last 2 minutes, is there anything you'd like to share with the audience as far as takeaways, or what you believe they should be the next thing that they should be doing?
My takeaway for everyone is that we are here for you. You are our community. We want to be your one-stop shop, where in terms of your journey begins with us and we're going on the journey together, and it's for the individual you. It's not cookie cutter.
I like that.
So thank you. So whatever your concerns are, please come to us, ask us. We do free consultations, and we can figure it out together. We have a wide variety of things that we're offering. So
amazing. Thank you so much. Any last things from the audience, John?
We want to thank you so much, Dr. Ali. And also, folks, this is welcoming to men of all ages as well. All right? I think a lot of men now are much more comfortable coming in, talking about health and wellness. And they want the whole package. Dr. Ali is there to give them the whole package. She has all the professionals available, and it's in a very convenient location in Plantation with residential and commercial areas. Dr. Ali, I want to thank you again from All County Healthcare and from the community down here in South Palm Beach County, as well as Broward County, of course. Come out and see Dr. Ali in Plantation at 331 North University Drive, Suite M as in Mike, 2, 800 in Plantation, or call 954-688-7255. Thanks again.
Thank you so much.
thank you.
You had one last word. Go ahead.
I was just going to say, please come to our grand opening. It's in a week from now at our location. Lots of grand prizes and giveaways and raffles going on, and specials.
Thank you so much. We'll see you next week, everybody. Thank you
you
again for tuning in. Have a great evening.
share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244